Okay, so I've been asked to talk about trust in 10 minutes, uh, particularly with reference to vaccines. So let's go back a bit in time. 60 years ago or so, when the first polio vaccines arrived, everybody who had the possibility stood in a line to get their children vaccinated. Now, ago, there were reports of vaccinators in the global GPEI, the polio eradication program, being shot in South Asia. Rumors about the dangers of MMR proliferate on internet, despite all the research that says there is no connection with autism. Many people today say, take a COVID-19 vaccine, even if when there will be one. It's a lot of people, 40, 50, 60% in some countries. So clearly, over the course of a few decades, something pretty significant has changed in the way people think about vaccines. So what's changed and how can we understand it? And what are we supposed to do about it if we believe in the value of vaccination? So I'm going to suggest that the roots of our present predicament are triple, that there are three distinguishable roots of the situation we're now in. The first one is a suggestion, my suggestion, that vaccines have been oversold. They've become a kind of, they've been turned into a kind of holy grail of public health. The expression used to be a magic bullet, but I think I prefer holy grail. We see it in the publicity and the media presentations of a COVID vaccine over most of the past few months. But that's not new. The idea that a vaccine will solve our problems has been around for quite a long time. You can see it in popular culture. You can see it in movies like Contagion. You can see it in TV series like The Last Ship. It's a pandemic threatening humanity, which is then saved by a few intrepid virologists. The risk of an excessive faith, because the existence of a vaccine does not solve in itself public health problems. The consequence of a possibly excessive trust or exaggerated expectations can be tremendous disillusionment and disappointment. But this, as I call it, overselling of vaccines is only the first of the three roots. The second, I think, has to do with the changes that have taken place over the past 40 years in the way in which vaccines are developed, produced, and provided. Years and years ago, many countries in Europe, in Eastern Europe, in Northern Europe, some countries in Africa, a number of countries in Asia, and a number of countries in Latin America had got public sector institutions manufacturing or trying to produce the vaccines that the public health system of their country required. Now, it's true they were large, often underfunded, inefficient, inadequately regulated, but they were trying to produce the vaccines that people wanted and needed, and they were, at least in theory, politically accountable. These have largely vanished. There are very few left. Most vaccines today are produced by global corporations in response to, we don't know what, perceptions of commercial possibility, opportunity. We don't know to what incentives the producers and manufacturers of vaccines today are responding. It certainly is not only, or perhaps not even principally, public health need. The process of vaccine development and vaccine production has become decoupled not only from national health policies, but even more obviously from community perceptions of needs. The priorities which govern vaccine development and vaccine provision modifications to national immunization programs are not those of poor countries. They're certainly not those of poor communities. Nobody in the global south asked for a global polio immunization program. The result has been not only that we don't necessarily get the vaccines that people are demanding or would like, we do get vaccines that people don't really think are terribly essential. Few people really felt a tremendous need for a vaccine against mumps or a vaccine against chickenpox, but we have them and they're being introduced widely. So the second route that I wanted to refer to is changes in this system of vaccine development and provision and policy making. And the third and final one are changes in national political systems. Vaccines are not only important tools of public health, they also can function as political symbols. And in ways, for reasons that are not totally clear, at least not to me, disaffections with government, with politics, can be projected onto a state-mandated or governed or run vaccination system. We see it in the rumors that arise around vaccines. We're seeing that now. Weird rumors around COVID-19, weird rumors about the vaccine, especially, by the way, the Russian vaccine, but that's a subsidiary question. Why all these weird memes around the Russian vaccine? But let's leave that. This is not new. We saw rumors around vaccination in northern Nigeria 10, 15 years ago, that they'd been contaminated by anti-Muslim forces. We saw rumors earlier around neonatal tetanus vaccination in Cameroon as being an assault on the fertility of Muslim women. We saw rumors around HPV vaccination in some countries of Eastern Europe. Now, these are just examples that have been reported by anthropologists. Their emergence reflects a sense of historical injustice. They reflect a sense of disaffection, a sense of an uncaring state, and they reflect widespread reduction in access to basic medical care as a result of neoliberal policies. Now, lessons to be learned, because my time's coming to an end. Despite the role of internet in carrying vaccine misinformation, and there's no doubt that this is the case, the seeds of that is misinformation, what is propagated through internet, takes root in soil which is local. The seeds take root in a soil which offers a fertile ground for their sprouting. And that fertility of the local soil depends upon a sense of community, history, memory, a sense of injustice, deprivation, and belief. And we need to understand these local sources of mistrust, of disaffection, of grievance, which enable those seeds of misinformation to take root. And finally, as my last point, we have to establish credible and legitimate and accessible systems for reporting what are perceived as vaccine-related injuries, equivalent to the VAERS system in the US or Eurovigilance in Europe. People need a legitimate channel for expressing their grievances. Otherwise, they look for illegitimate channels. Thank you.